This morning, health officials are once again recommending that you wear a mask when you're inside. This comes after the St. Louis area has seen a major spike in respiratory illnesses.
Right now, more people are getting sick with the flu, RSV, and COVID-19. So the Department of Health is recommending that we mask up when we're inside in those crowded spaces. Now, this is only a recommendation. I may note this is not a mandate. Let's take a look at the numbers here. Let's go to St. Louis City first. Right now, hospitalizations have increased 38% over the past month. In St. Louis City, the hospitalization rate is 15.5 cases per 100,000 residents, putting St. Louis in the CDC's medium community level risk category.
Well, if you're listening to the show this morning, you heard us break the news here because we got a memo sent to us from the City of St. Louis employee that the mask mandate is back in effect for city employees. If you work in the city, you got to wear one of these now. Seems weird. I forgot how weird this feels.
Oh, I hate that feeling. And we know they're not effective because the city sent out this press release saying it was a recommendation for the public if they're in indoor spaces, but did not send the part about it being a mandate for all city employees.
Yeah.
Just within the past hour, the city of St. Louis changed its mind about requiring masks for city employees. A day after announcing the mandate, they're now strongly recommending city workers wear masks. Good afternoon. Thanks for being here. I'm Kay Quinn.
And I'm Brent Solomon. The change comes after city leaders walked back some of the data they were using to support their initial decision.
Remember these? You saw a lot more masks around City Hall today than you've seen for a long time. In fact, city government workers today had to come to work with one of these on them and wear that, but the mask mandate was quickly reversed, dredging up old memories of the pandemic in more ways than one. It started out Thursday when the health department sent a memo to all city employees telling them that masks would be required all day, effective today. But then they issued a second release today, walking back some of the more alarming statistics from their first notice. Then finally, at 4 o'clock today, a third press release that said masks are now, quote, strongly recommended. I talked to health officials today who seemed surprised by the initial mandate. BJC Healthcare telling us BJC is not seeing a strain on hospital capacity. We're experiencing a seasonal increase in respiratory illness, which is typical for this time of year. So what prompted that late afternoon reversal? I've learned, in addition to misinterpreting or misreading some of the data itself, Governor Mike Parson's office said someone in their office spoke to someone in Mayor Jones's office and applied some pressure perhaps about this mandate. Meanwhile, the city of St. Louis is also recommending masks for everyone in the city of St. Louis if you're indoors and cannot social distance. That recommendation remains in place despite all the other confusion around this topic.
You're sure of it because people are listening really closely to this.
Right now, people should not be walking. There's no reason to be walking around with a mask. When you're in the middle of an outbreak, wearing a mask might make people feel a little bit better, and it might even block a droplet, but it's not providing the perfect protection that people think that it is.
So again, minimal, at least one mask, likely a double ply type of mask would be good. So one of the ways you could do it, if you would like to, is put a cloth mask over.
Well, let me just state for the record that masks are not theater. Masks are protective. Wearing a mask might make people feel a little bit better, and it might even block a droplet,